The Medicare annual enrollment period is here again and runs till December 7th. During this time of year, you are able to shop and change standalone Part D drug plans as well as Medicare Advantage plans with and without drug coverage. This time of year, most brokers are inundated with drug lists from current clients, and it is a daunting task to get through it all. In 2026, most of these plans do not even want to pay a commission. Brokers would typically make about $100 for someone who's new to a Part D standalone plan, meaning someone who's just turned 65 and enrolled in Medicare, and $40 every year after renewing. That's one time per year. The companies now can't pay us for that, and most of this work has become pro bono, which we are happy to do for our Medicare supplement clients. We consider that to be a service. However, with having hundreds of people who are losing their Medicare Advantage plans, and now the marketplace plans starting, the Affordable Care Act plans that is, for the under 65, we wanted to do this short little walkthrough video to show you how to check drugs on your own on both Medicare.gov and also on our link, which we'll get to at the end. So to start this off, you would just go right to Medicare.gov, and on here in the top left corner, find plans. You can log in and create an account if you like, or you can also just go right here without any account needed whatsoever. We're going to just look at Part D plans right here. You can add in these things, but let's just keep it simple and don't get any extra help with these programs. Do you want to compare your drug costs? Yes. And here we just simply add in our drugs. So for illustration purposes, I'm going to pick some expensive but common drugs. You can pick from the different dosage amounts and options and how often you get it every month. Picking some maintenance meds that are very common. Select your dosage. It defaults to the default. Do you take it once or twice a day? Every month? Do you get 90 every 3 months? It's also very important to make sure that you select the correct dose and composition. For example, levothyroxine is a common med for thyroid issues. However, most people take the tablet. If you take the capsule, you'll find that a lot of times it's not on the formulary at all or is extremely expensive. Tablet being a solid pill and capsule being powder inside of a casing. It's important to check your bottles to make sure you get as close as possible. After you get your meds in here, and you can add and subtract as needed, then you're going to pick your pharmacy. Most retail pharmacies are the same, meaning like CVS at one location versus another. You can find your exact pharmacy if it makes you feel better, but often you can just get by with just picking whatever's closest to you. I like to show a different variety of pharmacies. People tend to really like their pharmacies and they don't want to change, but drug prices can really differ across different pharmacies. And this will you add 5. I like to put in a little independent too. You can change your distance. After you get the pharmacies you want, continue to view plans. Now you let the tool do its work here, and this is exactly what we do all the time. There's 2 ways to compare drug plans. You could simply go to the lowest monthly premium, which is going to show you all the drug plans sorted by lowest to most expensive plan. As you can see here, those who've gotten used to the $0 or under $5 drug plan, that seems to be a thing of the past, at least here in Pennsylvania. In Pennsylvania, Humana Basic is the lowest cost. In Jersey as well, it's around $4. But use the tool, don't quote me on that. What I like to look at is if I go by lowest drug and premium cost, lowest yearly deductible, Deductibles aren't always important because do remember there is a 2100 cap on it, and once you reach that you max the plan out, and we'll talk about that in a second here. This is the total estimated cost. They're usually total estimated cost and total drug cost. And my tool, which I'll show you in a second, lowest drug and premium is your total cost. Lowest yearly drug deductible. Going back to lowest drug and premium cost, this is the total estimated cost. What this is factoring in is how much you're going to pay for the plan as well as the cost of the meds. You can compare a couple different ones. Sort it by what is my total estimated cost for the year, which includes the deductibles. These meds in pharmacies, Humana is the way to go. And of course you can do this for Medicare Advantage too. But Medicare Advantage is a lot more nuanced, because it's not just about the meds, it's also about the doctors and the benefits. For that, come back to us. We'll walk you through all of that. If you get stuck, we're still here to help. We have clients that have waited for us to get back to them, and we're just trying to expedite this a bit by showing them what we do and how they can double check to see if the drug plan they have now is the one to go with or if they should make a change. Picking a couple different ones here. Looks like Humana is good for all these meds. Add to compare. And at the bottom, compare. This is going to compare and tell you who's a network, who's a preferred, who's a standard. Preferred versus standard is going to differ in how the drugs are treated. You can see all your plan details, but the important number here, what I do is I go off of, I simply just find the one that has the best total overall cost. Here's your drug cost, and here's your total estimated cost. So this is factoring in your premium too. Not always does the most expensive plan make the most sense, because if you take a lot of meds, such as this example here, and you're going to cap it out in the first couple months, you're going to end up eating this premium the rest of the year. You can see all of these are right around the 2100 mark, which means they're all getting pretty close to being maxed out. A lot of times having the most expensive plan isn't the best fit for you. If we go to plan details here, we can see what our drug coverage is. We can see what it's costing us at all the different places, that being out of network for that. You can compare it to the different pharmacies. The deductible amounts here. This is the highest that Medicare will allow, $615. The lowest total estimated cost is this one, so I'm going to enroll myself. And then nice and easy. Again, if you wanted to log in, you can, but you can simply complete it in here. For illustration purposes, we're going to use a dummy number. This is the office address and my phone number. Other drug coverage would be if you have veterans coverage or you're a retired SEPTA employee, PACE, Medicaid, Social Security Extra Help, otherwise known as LIS, Low Income Subsidy. Do you currently work? Does your spouse work? Do you want to get things in the email or paper mail? What language do you prefer? Do you need any kind of accommodations in terms of print or braille or audio CD, standard print form? How'd you like to pay your premium? Do you want to get a bill every month, or do you want it to come out of your Social Security check if you're collecting? I'm the person joining the plan. Click here, hit submit. Very similar. You're going to enter in your drugs, enter in your zip code, and it's going to show you all the plans that I'm contracted to sell. Whether or not they're commissionable is another thing, but these are ones I'm certified to sell with. So we're going to add in prescriptions, just like we did before. Oftentimes people say, I use GoodRx. Well, that's fine. If you have a supplement, you really should have a drug plan, because the does keep track of how many months that you do not have credible drug coverage and will enforce a penalty if and when you go to buy anything that has drug coverage, such as a Medicare Advantage plan with drug coverage, or just a standalone drug plan because your needs change or GoodRx stops servicing you. Just because you have a drug plan does not mean you need to use it. If you find that the prices are better on GoodRx, by all means do what you need to do. However, I'm always going to urge you to at least take the lowest cost plan in the area, or a low cost plan, just to have that coverage as a barrier. That way you're not charged any penalties down the line. They can get hefty. For example, without coverage for 10 years, take the number of months times the national average, which is around $34, times 1%, and that gets you your number. Say it's $80. That gets added to whatever Medicare Advantage or Part D plan you buy, and you can't escape it because the government keeps track. If you go with WellCare is told to charge $80 a month to your premium. There's an income chart for Part B and Part D based on your income filing from 2 years prior. If your income was higher, you could be charged more money for your drug plan. It becomes the carrier's responsibility to collect those penalties and costs for having higher incomes. This particular drug list on this particular formulary, that the lowest cost is mail order. This would be the 3-month cost, and you would see where you're maxing it out, see how it's changing because you're meeting that deductible. Now you've entered the catastrophic phase, the 2100, and now you're done and don't have any more costs for the rest of the year. So as you can see, if you're going to max the plan out in this instance, having the more expensive drug plan doesn't always make sense. Because if you're maxing the plan out no matter what, now you're eating premium the rest of the year. In this instance here, we're still getting done with these costs. And maybe the first month it was a little more tolerable, but the net result is paying the same amount of money. In fact, we're paying more. We're eating all this premium here. Once we get past May, we don't have any costs, and now we're eating this premium. And sure, we could drop the drug plan, but then we're into that same situation. We wouldn't want to do that because it'd be covered for the year now. We'd still be staring down penalties and such for not having drug coverage. That would not be in our best interest. If we go with the most expensive plan, now we're eating premium the rest of the year versus the $8 plan where our expenses are higher up front, but then the rest of the year we only have an $8 premium. At the end of the day, we're still maxing this plan out. Maybe we paid a little bit more here, but on the back end, we're only paying $8 a month. These tools do their job. They're not perfect, and they're as good as the information being put in. I know that drug plans can be very complicated. We are here to help you. Text or email us too is the most efficient way to get to us, especially with drug plans. The priority has to be on the Medicare Advantage folks because they are losing their coverage. Just here in the Philadelphia region, there are 50,000 members losing their Independence Blue Cross Medicare Advantage plans. Highmark in Pennsylvania, Delaware, West Virginia, and parts of New York, it's 160,000, and United Healthcare about 600,000. These are Medicare Advantage plans. We get to everyone we can. Those folks do not have a plan January, and they need to make a decision. The drug plans can be really just a quick, easy fix, quick, easy change. If you want to use our system, we can double check your work, or if you're in Medicare, you can tie in your drug list. So that's where we're at right here. So remember, we have till December 7th to change or buy a Medicare drug plan. Drug plans don't have a lot of slack. You have to pick it by December 7th. There's very few instances that they let you change it throughout the year. When it comes to Medicare Advantage plans, those who are losing their coverage, they do get till the 31st of December and actually even 60 days after that. If they're losing their Medicare Advantage plan and they do nothing, they're going to go back to original Medicare with a 20% cost share. Yes, that would give them the ability to buy a Medicare supplement if they wanted. However, they're going to be mandated to certain ones if they're not healthy. So their guaranteed issue plans is going to be based on when their Medicare Part A day went into effect. The internet is wrong. It says the B date is the A date. If you were on Medicare Part A prior to 1/1 of 2020, your guaranteed issue plan is F. And if it's after that date, your guaranteed issue plan is G. Some companies, such as United Healthcare in certain states, let you have other plans, but those are the ones that are required by the government to offer you when your Medicare Advantage plan loses you or you move out of the service area. Also, Medicare Advantage plans have what's called the open enrollment period, which used to be the general enrollment period. That period is from January 1st to March 31st. Pick a plan you don't love, or you're finding that the prescriptions weren't great, or someone talked you into something. You actually get another one-time change from a Medicare Advantage plan to another Medicare Advantage plan once during that time period. A bit more leniency than you do with these drug plans, which you have to make a decision by December 7th. I wanted to put this video together to show you how you can check these things for yourself and enroll in a plan. As the open enrollment periods get more and more hectic, with the marketplace starting now and coverage way up because news of the extended subsidies not being extended, although that's still depending on what Congress does. There's a lot of chaos this time of year. If you do buy things through our page here, you also have an account with this here. What I showed you right here is completely consumer facing. It's a website, and you just fill this out. Nice and easy. With drug plans and advantage plans, the government keeps track of that stuff. One usually replaces the other. And what you do this time of year dictates to the government what your intent is. If you're in original Medicare and you buy an advantage plan, you've now signaled to the government that you'd like to go to Medicare Advantage and to get out of Medicare. That does not cancel your supplement, though. You do need to do that yourself. And you cannot have a supplement and an advantage plan at the same time. If you're buying a new drug plan, you don't have to call your old drug plan because the government's going to tell the old drug plan that stopped and you're now on this. I've seen some instances where there's been some craziness happen. Pretty much is usually always turnkey, but it's always good practice to make sure that the prior company did stop taking any kind of payments. To be safe, check your bank. Usually Medicare does a good job of replacing one with the next and making this as non-confrontational as possible to senior citizens. If you are on a Medicare Advantage plan and you buy a standalone drug plan, you've now signaled to the government that you wish to leave Medicare Advantage and go back to original Medicare by buying that drug plan. Now, in that instance, you're not guaranteed a Medicare supplement. So if you're not in good health, you're looking at paying 20% of every bill, more or less, depending. It gets into the weeds, but generally speaking, Medicare A and B, traditional Medicare, covers 80% of the cost, and you're stuck with 20%. If you do go back to original Medicare and you're not healthy enough to qualify for a supplement, the open enrollment has nothing to do with supplements. You can always change your supplement, but it's based on your health. They can rate you up and deny you. How can they do this? Is because Medicare Advantage plans have to take you. The Advantage plans are there. People have different feelings on them, Medicare supplements versus Advantage plans. Generally speaking, Medicare Advantage plan is better than having nothing at all. Medicare on its own, you're looking at that 20% cost share with no cap. At least the Advantage plan gives you a stop loss, a maximum out of pocket. It's easy to get out of them, right? Up till March 31st, if you're in one, buy a drug plan, that removes it for you. I hope you found this video of value. Feel free to reach out to us. Email's the most efficient way. DoItForMeInsurance.com. Take care.